I want to introduce, we have Kayla, Kiana, Megan, Adrian, and Jay. And we're just going to have an open talk about some mental health. How's it sound? All right. So we're going to start with Kayla. Go for it.
I mean, what like specifically should I talk? Like, I don't know.
Whatever you want to talk about. This is whatever you.
I don't know. Like lately, I've been having a conversation, especially like at work here with my customers, and they're just like really worried about things that are going on right now, especially because I don't know about over there or where anybody else is, but they're doing like shutdown number 2. And everybody just seems to be really worried, and I kind of feel bad, like seeing my customers like worry and other people like around me like don't know if they're gonna still, have their job right now. And I don't know. Right now, just everybody just around me just is so scared and worried, and it kind of makes me scared and worried also. But I also like try to be strong, and I try to be like, everything's gonna be fine. Everybody will be safe. So I don't know, like part of me does feel worried, especially like working at a bar, because it's like our hours are getting cut, and we're not allowed to have certain people, like we're not allowed to have people sitting at the bar also. So it's just really weird. It's a really weird time right now. But that's how, I don't know, that's just how my head is running and feeling right now.
No, that's perfect. It's a scary time. It's definitely a scary time right now. COVID has affected so many people's lives, and the fact that we have to go back into a kind of a lockdown number 2 really kind of sets the precedence of everyone's mental health, because now we're talking about a 4 to 6 actual lockdown. Like we hadn't gone through a lockdown like this that they keep talking about. Things were kind of shut down a little bit. Things were limited. You weren't able to go outside. You weren't able to do all this stuff. But what they're talking about now is an actual lockdown. And we saw this in other countries where they were locking down. But the United States didn't go forward with an actual lockdown. So it's a scary time. So making sure that we're taking care of our mental health is extremely important. And yeah, thank you for touching on that subject, because COVID is something that no one was prepared for. People have been locked inside their houses. People have been kept away from their family. Some have lost friends, family, and it's just a hard time for everyone that's going through this right now, and the whole world's going through it. And so it's a scary time, but I mean, if we all come together, just like mental health, if we all come together, we can start finding ways that it really does make an impact. And as soon as we all come together and stop the spread of COVID and get further along in the process of actually getting a cure, the more things will actually have an opportunity to go back to normal. So thank you for sharing that.
Can I add something?
Yeah.
So I've been kind of sick this week, right? I noticed earlier on the week I kind of got a sore throat, and then got a really bad ear infection, and then I've been having like super bad fever, and then I have the chills, and then my body aches, and I was like, oh no, what if it's COVID? And of course my anxiety kicks in, and it's like, girl. So I took my son and I both to go get our COVID test today. And for the first time in my entire life, I got a flu shot, and I made him get one too, because I was like, we just can't risk it. At this point, I feel like the flu shot isn't exactly a COVID shot, but at least if I do get sick, then I will know. And that was one way I kind of helped ease my own anxiety, where I was like, all right, so I'm sick now. I have to wait 3 to 5 days to figure out if it is COVID or not. But, at least I'm hoping it's not, because I have the ear infection. So I'm just hoping it's just more related to that. But I don't know. I feel like the flu shot really helped me curb my anxiety a little bit, where I'm like, all right, I can wait a few days and then I'll be fine for the rest of the year. So it's
Yeah.
definitely affecting people's mental health for sure.
Yeah. And I actually had to go get a flu shot literally this week as well, which it's the first time I've had to get a flu shot. And I don't believe, I have personal preference. I don't believe it because the first time that I did it, I got the flu. So I don't know how in relation that is. I was just that lucky one person that gets sick when you get the flu shot. And it happened. And every year since then, I've never got it. And I've never got the flu. So it was just like, so I actually took a peer support specialist part-time position because I'm going to be working with this outpatient group, and I'm super excited to be a part of that as well. To learn a little bit more on the professional side on how we're helping people and everything too. But they're like, all right, go get your flu shot and then go get COVID tested. And I was like, I'll do the COVID test. They're like, all right. So I had to go get it, but yeah, it's scary. And also, like, I've had like two friends that ended up getting the flu, and the whole time when they started getting sick, we're all like texting each other, and it was like, hey, just stay home, please. Just don't. We'll get you a care package or something. They're like, no, 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 it's different. It's different. Like, it's, I don't know. Like, it's not, I'm pretty sure it's just the flu. And I was like, I'm also pretty sure I'm not going to go see you right now, just in case. So, but they ended up going to go get their COVID test and everything done too. And that's a scary time, especially when they're experiencing symptoms that are similar. So I could only imagine. I could only imagine that initial just anxiety of like, no, 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 I was so careful. No.
And I was. I blame it on the gym because not everyone at the gym is following social distancing or wearing their masks, and they're not wiping down their equipment. I wipe down all my equipment before and after. I use my hand sanitizer, but I've been keeping my distance from people, so I'm just like, I don't know how I got sick.
Yeah. I think COVID can be a really scary time for people with mental health. I personally am both a hypochondriac and a germaphobe, so yeah, really fun. So, every time I would go into it, well, I didn't go anywhere for like the first 2 months probably, which was terrible because, you're indoors all day. I wouldn't even go outside. It was that bad. I was just paranoid. I was going to get anything from anywhere. The first time I went into a restaurant, I had a full-blown panic attack. It wasn't pretty. So, it can be terrifying on all different levels, and, you never know what someone else is going through. And I think it's just a time where we need to all take care of each other, but at a safe distance.
Yep. Yep. But yeah, I mean, this is a real life conversation. Like everything else, this is real life. This isn't some people experiencing stronger levels of anxiety. This isn't other mental illnesses that we're going through or just experiencing our mental health. This is something that's really out there, that's really putting us all in the same exact bubble. And the more that some people aren't taking it serious, well, the people that are just getting in worse positions in their mental health, because we see that more and more cases are coming out, and we're seeing that we're hitting record numbers every day. I've never been more excited to see super high numbers. No, that's not we're not doing great. We're not doing great right now. And it's just not getting better. So, I mean, if we don't start doing something soon, more, it's not going to just go away. Everyone's saying, oh, 2021 is going to be a better year. Like, COVID's not stopping December 31st. That's not how this is going to go. But making sure that we are really taking care of ourselves right now and finding something that works, because a lot of people have gone virtual with work and they feel like the amount of time they're spending in just one house is raising a lot of anxiety, is making depression numbers go extremely high. And the big thing that I was talking about, I was talking this with someone else yesterday, but like the students that are in school right now that have to do everything virtual, some of these kids are, that hostile environment was home and school was their outlet. Now, those kids are in that environment all day for the most part. And those kids are the ones that are high at risk right now for not taking care of their mental health. So that's why we're trying to do this now. That's why we're trying to reach out to as many people as we can. You know, even if it's just a simple message, it's something, because there's a lot of kids out there that really just need a friend or need someone to talk to, because emailing your counselor may not really explain how you're feeling. And so it's a different beast, especially on all of our mental health, because it got really bad for me at the beginning of this year, and that's just a dangerous spot for me to be in. And I mean, it's a blessing and a curse, because it was a really, last year was one of the worst years of my life. And then, you know, you get that whole new year, things are going to go better. It did not go that way. It did not go that way at all. And then, you know, COVID hits and throw in a manic depressive episode, and then you're just like, okay, it's getting a lot worse. It's really dark outside right now. But, you know, it made me start talking to the right people. It made me start wanting to find my voice, because I wasn't doing okay alone. And, you know, we've got 6 people all willing to be there for other people and really take care of their own mental health at the same time, because this isn't just us saying we all got it. This is saying that, hey, we all struggle. We're all going through something right now, but we don't have to go through it alone. So I kind of want to open the floor back to, let's go to Kiana. Let me know kind of what you're thinking. We kind of went on a COVID tangent, but that's real life. This is real life. So yeah, everybody, this is Kiana.
Hi, y'all. I'm Kiana, and definitely going back to what you, Joey, Adrian, and Kayla said about COVID, I definitely agree. And in case y'all can't tell where I am right now, I'm in my dorm as we speak, and having to do in-person classes and just kind of adapt to COVID rather than staying inside until they find a cure. Just the whole world having to just adapt and just go day by day. Just having this thought in the back of my mind, like, what if I get sick? What if I take the proper precautions? Just all of that. It's just really surreal right now. And just us being in that mindset of surrealness, definitely the conversation about mental health needs to be had, because we are not in a normal experience right now at all. And for me personally, going into COVID, I was dealing with losing my job. Like, I had gotten fired. And when I had to pack up my stuff and move 3 hours home, I couldn't really find the time to really cope with that, because I was finishing out the semester virtually. And it was just again, surreal experience that really took a toll on my mental health. And I had just started seeking counseling myself, and having to switch gears from in-person to phone call counseling while in my parents' house, trying to find a secure place where they wouldn't really hear, because confidentiality. It was kind of an adjustment for me. So in those 6 months having to be home, I realized how truly important it is to take care of mental health and about finding like resources. It can be easy to say, oh, you have to take care of your mental health. Oh, go seek counseling. But what about the people who don't have that privilege, who don't have that access to counseling, who have to worry about insurance? And this is really why being a mental health advocate is so important, because you can advocate for people to have those resources, to have those abilities to just have better access with low cost or no cost, really just through social media, like what we're doing now. Like it's probably helping so many people. And just, I'm really glad to be a part of this because that outreach is so important. And with that being said, I have my own mental health struggles. I struggle with depression and anxiety, and as well as body dysmorphia. I noticed that on social media, I will constantly be comparing myself and just looking in the mirror and just feeling so unconfident to even go to like social events because I'm just worried about how I look, how other people may perceive me. And it's really gotten to the point of affecting like my normal life. So I just want to know, well, I just want other people to know that they are not alone in their struggles and that it's really somewhere, well, someone like them that can relate to them, as well as with anxiety and depression and with other things that we don't talk about, such as burnout and imposter syndrome, like just having to put on this image that, okay, I'm fine and I'm just going through the day just so no one would really have to worry about me because I'm not talking about it. That can really take a toll on you. And like I said, with my previous job, I did have to just have a straight face and I was really burnt out, but I didn't want to show it. So I just have to keep working through it. But it really took a toll on me. My productivity got affected. And with that being said, that's when I got fired / quit. It's a long story. But anyway, my mental health, my declining mental health affected my job. I didn't have time to cope with it, but now I definitely see why it's so important that people take mental health into consideration. And yeah, that's pretty much all I have to say about that.
No, that's I'm really sorry about your job. I mean, that's really tough, especially having to go through all of it at one time. It was just like, hey, I don't know if Kiana knows how to juggle, but let's see. And just threw another ball in there, and you're just sitting there. You're just like, I'm just trying to hold it together. But yeah, that's a huge topic too. Just mental health in the workforce, and like for me, the last job that I had, I was in sales, and it was really great. And then my manager actually left, that I really liked. She was super awesome. And then another one came in, and mental health was not a priority. And for me and my other manager, that was the conversation. I was like, hey, sometimes I'm not okay, and you guys need to know this, because I think it's just best if I just stay home, because sometimes I don't really enjoy crying off and on between calls and just pretending like it's okay, because then what happens? You get someone hears you crying, or you can't hold it together, and then, hey, you all right, man? Yeah, I'm good. I'm good. I'm good. And then you have this whole internal struggle, and it just, no. And then so I ended up having to take like a day off. And I remember coming back, HR was like, hey, like, is everything all right? And I was like, no, it's not. But thank you. I thank you for asking. And she was like, oh, okay. Like, we had this whole open conversation. She was like, yeah, like, she opened up about her mental health, and like she had been going through some stuff, and I thought we really bonded. And then an hour later, my manager pulls me into his office. He's like, hey, I just want to know when you're going to kind of make up that time. And I was like, for what? He was like, well, you took the day off. So like, are you going to stay late today? And then like kind of I was like, I took a mental health day. I don't care if you take the day out of my pay. Because depression doesn't go away in one day. I was like, I just needed the worst day off. I was like, but you're making today a really bad day too. Why are we doing this right now? And he just was like, all right, well, goes into this whole printed out form that he had, and he was like, hey, if you can't upkeep and do your job the way that it needs to be done, if you can't take care of it and take care of yourself, then we can find someone that will. And I'm just like, and what made it so much worse is literally the day that I took off, the day I came back, no, the second day after I came back, like someone actually took their life in the parking lot. It was like this whole ordeal. And I was just like, that drove my anxiety and everything through the worst. Like everything just went through the roof. I was like, this is the problem. We don't know what was going on in that person's life. I was like, I just was really sad. And you guys are talking about letting me go because I couldn't stay another day. And that's just normal work field. Like that is just normal workforce. There was no pandemic during this time. And it's just like, man, like you can't have me sign papers saying, are you disabled or not? And me say, yes, I do have a mental health disability. Thank you. What is it? Depression, bipolar. Okay. PTSD, anxiety. Cool. And then you hire me. And then it's like, oh, you need a day off? I don't know. It's too contradictory. It's you either are going to care about my mental health or you're not. And if you're not going to make it known in the beginning, then that's where the disconnect between the employee and the employers and those in charge really is. Because I used to love my job, kind of. I enjoyed the people that I worked with. And it was a really fun environment. And as soon as a new management came, everything changed. And then you feel like your mental health is declining. And then that conversation happens. And I'm not the first one to have to talk to HR about my mental health. I don't know if you guys have ever had that conversation, but it's with her, I felt like things were okay. I felt like someone saw me for who I was, not just another employee. Like she just like completely opened up, and then like my manager, he was just like, yeah, no, you can't be doing that. And that was the worst. And when I left, I end up leaving right before December, and I was just like, no, I can't. And like all last year was like a terrible year for me. Got out of a long-term relationship, went into some dark times, ended up just jumping into another relationship because guess what? I have a codependency problem that I didn't realize I had. And then you start addressing those problems, and it's like, man, when do we get a break? When does it get easier? And it also, honestly, it didn't get easier until I started talking, until we all started talking. Hello, friend. Adrian, I am watching your lovely dog just showed up, and that was a pleasant surprise.
He's a love dog.
But yeah, that's kind of just a little bit like, I'm just happy. I'm happy that we're in this safe space. I'm happy that you guys found this safe space, and I'm also happy to introduce Megan.